If you have neck pain at the moment, it's really important that you understand exactly what's causing your neck pain before you start thinking about stretches or exercises to strengthen your neck. In today's video, I'm going to explain everything you need to know about the most common causes of neck pain that I see in clinic. Now, please bear in mind that there are a lot of causes of neck pain and I can't possibly go through them all in today's video. So what I'm going to do is just go through the most common ones that I see. What I will do is just put up here a short list of possible causes of neck pain that you could see. Bear in mind that there are some causes of neck pain that are slightly more on the rare side, but still pretty serious. So if you do have neck pain, please go and get yourself assessed by a professional who can diagnose what the problem is. Now, that being said, the first thing we need to think about when considering neck pain is the anatomy. If you can understand how the neck is formed, what's going on in the neck, the musculature, then you can understand better how you can stretch or how you can strengthen your neck and how you can prevent it coming back. So the first thing we're going to look at is the model of a neck. So this is just a model of a spine. This is the back side of the spine. So all these bumpy bits, these are called spinous processes. This large bit up here is the occiput. So this is the base of your skull. There are 7 cervical vertebrae. 1, 2, 3, 4, 5, 6, 7. So these make up the neck. Underneath that, you've got the thoracic, and then lower down, you've got the lumbars. When looking at the spine, what you'll notice is you've got each vertebra, and in between each vertebra, you have the discs, the intervertebral discs. I'll explain about these in a minute. The yellow things you've got coming out are the nerves, and then the red things you've got going up alongside here are the vertebral arteries. So all of these are really important structures. Now, let's talk about the vertebrae first. So these things on the side are the facet joints. Hopefully you can see them. They're slanted downwards. These are the top part of one vertebra and the bottom part of another. And what these do is they allow certain movement within the vertebra. So in the neck, we've got a lot more movement that's possible. As you go further down the spine, these facet joints change their orientation. So it limits movement in certain directions, but the cervical spine's actually got quite a lot of movement. The reason I highlight these facet joints is because these are very commonly compressed in a lot of patients that I see. So this is one possible cause of neck pain. Another cause is pain coming from the nerves. So any compression on the nerves can cause pain in the neck, shoulder, or down the arms. As you may be able to see, there are openings where the nerves come out. These are called vertebral foramen. Now, it's possible that these holes, we'll just call them holes for now, just keep it simple, can get reduced in size. Now, that could be because the bone of the vertebra has deposited more bone. And what that can do is that can compress the nerves and cause pain. You've also got the facet joints. If they become irritated or inflamed, the inflammation around those facet joints can cause sensitization of the nerves, so that can cause pain. Then we've got these discs in between each vertebra. Now, I've mentioned in previous videos that discs are rings of sort of cartilage. In the middle of those rings, you have a gel-like substance called the nucleus pulposus. As you move, that nucleus moves in opposite directions. So as I bend my head to the left, the nucleus will shift to the right. So the discs are quite dynamic in nature. Now, what can happen over time is the rings of these discs can become worn down. Eventually, what can happen is the nucleus can protrude out through the back of the disc, and that can cause compression of either the nerve roots, so the yellow thing coming out here, or the spinal cord itself. We'll go into that in a little bit more detail in a minute. Then more superficially, which you can't see here, is the musculature. Now, in the neck, there is a lot of muscles. So anytime there is some kind of neck injury, whether that's a facet joint compression or a nerve irritation or a disc bulge or prolapse, you can pretty much guarantee that the nerves will go into spasm. Now, spasm in the neck is very, very common, and it's one of the most common things I see in practice. So whenever treating a neck, you can pretty much always assume that there's going to be some form of muscular spasm. Now, moving back into the vertebra, it's worth considering that as we get older, The discs can become less hydrated, meaning that the vertebrae become more closed together. So the distance between each vertebra becomes reduced. This can cause additional wear and tear or additional load forces through the vertebra, and that can cause wear and tear of the joints or build up of bony deposits or bony tissue. So we can get osteoarthritis within the spine, and that arthritis can cause pain and also reduction in movement as well. So when looking at older populations, it's worth considering that it could be some arthritic change. Now, moving on to a slightly less common cause, but still, or causes, but still very important to be aware of. One is meningitis. So meningitis presents with neck pain, sometimes headaches, an aversion to bright light, and pain in flexion of the neck. If this is not treated or this is not seen to quick enough, it can be potentially life-threatening. So if you do have headaches associated with neck pain, an aversion to bright lights, please go and get yourself checked out by a doctor. Another thing that could happen in the neck is referral of pain either from the shoulder or from the heart. If it's from the shoulder, it's obviously not as severe, obviously not as important for you to go and get seen. But if you have, let's say, angina, or you're having a heart attack or something along those lines, you can experience pain mainly on the left-hand side of the neck, up into the jaw, and of course down the arm. So it can often mimic simple neck pain, or it can mimic sort of a nerve entrapment. So if you are worried about it, then please do go to either the emergency room or go and see your doctor. Now, when people present with neck pain, one of the common things that people have is headaches. Now, I've already mentioned it could potentially be meningitis, but let's assume for this video that it's not, and it is just a simple mechanical headache. So as I've mentioned earlier, we have blood vessels running up the neck. So we've got the vertebral arteries and we've got the carotid arteries on both sides of the neck as well. Pain or compression or muscle spasm within the neck can potentially cause constriction of certain blood vessels, whether that's mechanical through compression or through something like inflammation causing muscle spasm. If this happens or is compressing a nerve, people can experience headaches, usually towards the base of the skull, back of the head, base of the skull, and sometimes coming round like a band across the head. I find that as we start to relieve tension through the neck, through the muscles in the neck, the headaches tend to resolve relatively straightforward. Every now and then, some headaches are really difficult to get rid of, and sometimes it's not always the neck pain or a neck issue that's causing headaches. So again, if you have headaches, go and get that seen to as well. So let's now just discuss what could be causing your neck pain. So let's start first of all with differentiating between a disc and a facet joint. Now, I've already mentioned earlier about the nucleus within the disc and how that can bulge out through the back of the disc. Generally speaking, as you flex your head down, that would push the disc further backwards. So as you bend the head this way, the disc is going to come more out towards the back of the neck, likely therefore causing compression of the nerves. So when examining patients, one thing we can do to try and differentiate is what's causing the neck pain. If flexion of the head is causing more pain, or coughing or sneezing causes pain, then it is possible that it could be a disc. Now, when we have disc problems, in my experience, a disc tends to be quite painful. So most people will be in constant pain, very acute pain. Simple movements will cause pain. So if coughing or sneezing or flexing the head forwards causes pain, so when I say pain, I mean like a sharp pain, possibly even pain going down the arms, as opposed to a feeling of tightness within the muscles at the back of the neck. If, on the other hand, that doesn't cause pain, then it's possible that it could be a facet joint. So facet joints, as I've mentioned earlier, they're overlapping. Now, if you have a look at how they overlap, as you look up towards the ceiling, those facet joints are going to compress. So when they compress, if they're irritated, that's going to cause more pain. So that pain is going to be like a pinching sensation. Now, sometimes it can be very specific. So you could probably put your finger on where you feel the pain when you look up. So it could be like mid-neck, somewhere around there. So looking up or bending the head to the same side. So if, for example, I had a facet compression on the right, if I bent my head to the right, I would feel an increase in pain. If, on the other hand, I was to bend it to the left, it would generally feel just tight, but not as painful. So that's one way of differentiating between disc or facet joint. Another thing you could try, if you suspect it could be a facet joint, is I use distraction of the head. So I would stand behind the patient, cup the back of the head, and then lift, asking the patient if it feels better, worse, or no different. If it feels better, usually that's a good sign because the pressure of those facet joints has been reduced. So you've gapped the distance between the two facet joints, or the two vertebrae, I should say. If that feels good, then what I'll do is put compression down on the head. So I'm compressing those facet joints. Sometimes that's enough to cause some pain, in which case that's a very clear indication it could be facet joint. If, on the other hand, it doesn't make much difference, what I would then do is get them to extend their head upwards, possibly with a bit of side bending and rotation, and then put compression down as well. Usually I wouldn't add side bending. Usually extension is enough to cause pain. But anyway, compression of the head, compression of the vertebra causes pain, so that indicates it could be facet joint. Now, with either a disc problem or a facet joint, you would expect to have muscle spasm. So part of treatment is all about trying to get the muscles to relax, muscles to release, get rid of that tension. Now, regardless whether it is a facet joint or a disc, if there's spasm within the muscles of the neck, that spasm is going to cause more compression. So in the case of a facet joint, it's going to compress the facet joint. If it's a disc, it's more likely just to put more pressure on the discs, and therefore every movement you do could just increase the likelihood of pushing the disc or the nucleus out from the disc. Now, if it's not facet and it's not a disc, it could be arthritic changes. So it could be bony deposits or joint surface changes. Now, you would expect to get this as you increase in age. So 60s and onwards, usually sort of mid 60s and onwards. Now, with arthritic changes, when you ask someone to move their neck, there will usually be a certain point that they can't move past. Then when you feel it, so if I was to feel a neck and move the neck from side to side, as I rotate it, it would kind of stop in a very hard manner. That would indicate it's more bony, as opposed to muscle spasm, which would kind of just tighten up as it goes to the point where it doesn't want to go anymore, but there's still a bit of spring within it. Now, the only way really of diagnosing arthritic changes is with an X-ray or even an MRI, but an X-ray would usually be sufficient. If you wanted to diagnose a disc, then an MRI would be the best bet. A facet joint, you wouldn't really see any irritation or compression within that, whether it's on an X-ray or an MRI. So that brings me to my next point. Should you go and get an X-ray or an MRI, or neither? Now, in most cases, most of my patients, we don't need X-rays or MRIs. First of all, if you're sending someone for X-ray just as a matter of routine, you are exposing them to radiation. So do you really need an X-ray if it's just a muscle spasm? Probably not. Now, sometimes you can do an X-ray and it will show maybe your posture is no good, or you've got like a straightening of the spine, or your alignment is not so good. So from that point of view, it can be an interesting finding, but is it essential? Probably not, unless you've had neck pain for many, many months or even years, in which case you want to find out exactly what's going on. Now, in terms of MRI, I would only send someone for MRI if I suspect that there is a disc prolapse. Most of the time what we do is go through treatment first, trying to relax the muscles, trying to get more movement through the neck. If things don't change or things get worse, then I would send for an MRI. If I sent someone for an MRI first, sometimes that comes back and it could show a disc problem. I potentially could have a disc problem and I don't know about it right now. So the point is, you could have a disc problem, but it actually may not be the cause of the pain. So that's why sometimes it can be a bit deceiving if you send someone for MRI. So do you need one? Probably not at this stage, but if things get worse or they don't change no matter what you do, then it could be useful going for scans. Now let's talk about the approach to your pain. Now, as I've said before in previous videos, I work in 3 phases. Each phase has a different treatment approach depending on where you are in terms of your pain. Now, usually if someone comes in, they are in acute pain. So the pain is extremely high. It's quite recent, very, very intense, very unforgiving. So the inflammation and pain is quite high. So I would put someone in phase 1, and the purpose of phase 1 is to reduce inflammation and reduce pain. As the pain comes down, what we're usually left with is tightness within the muscles. So the purpose of phase 2 is to improve the flexibility and the mobility of the area. So in this case, the neck. And then as we move further on, phase 3 is about increasing the strength and the stability. So if you are in phase 1 right now, it's all about just gentle movement, ice packs to reduce inflammation, painkillers if you can take them, and just allowing the body to reduce the inflammation and reduce the pain. As you move into phase 2, then it's about reintroducing stretches. You could use massage balls, you could go for massages, you could go for treatment, or you could even use traction devices. And I've done a video about traction devices, which I'll link just here. Then as your flexibility and movement starts to improve, the next phase is to increase the strength and stability. And the purpose of this is so that we can strengthen those muscles and prevent the problem coming back. Now, quite often, people end up in pain because those muscles are weak to begin with. Now, that kind of brings me on to another cause of pain. Quite often, people do something very minor, such as sleeping. They wake up in the morning and their neck is stiff, or something happens which causes their neck to flinch and the muscles go into spasm. That's just a sign of deconditioned muscles. So as the neck starts to get stronger, those muscles become less and less overreactive. So when something happens, although you may flinch, the muscles won't necessarily go into spasm. I'll give you an example. My daughter sometimes, so she's nearly 3, my daughter. As you may or may not know, kids are very unpredictable. Sometimes you get things thrown at your face or you get fingers poked in your eye. When that happens, I might flinch. Now, in the past, as I flinch, it would cause me immense pain in my neck because I had a facet joint compression, and that would cause spasm in the muscles. Now, the muscles were then weak because I hadn't exercised them. Now they're stronger, so anytime that happens, the muscles don't go into spasm, they don't overreact, and I don't get the same amount of pain. And that was just through strengthening my neck. Now, if you want to learn more about the 3 phases of pain and what you can do in each phase, I've got a free ebook which I will link in the description below. So that will tell you all about those 3 phases. Really worth you having a read. If you want to know when to stretch or when to start moving into the strengthening phase, etc., etc. Let's assume you're in an acute phase right now. It's all about the movement, gentle stretching, ice packs, anti-inflammatories. I'm not going to do a further video on that. There's not much to tell you about that. But as we go into phase 2 and about the stretching, I'm going to do a follow-up video which is going to show you exactly how to start stretching your neck, whether it's with yourself, actively or passively using your hands. How many reps, how long for, how often. And then following on from that, there's going to be another video showing you how to strengthen your neck. So hopefully today has given you some insight into the causes of neck pain. Hopefully it has all made sense. If you have any questions about anything I've said, please put those questions in the comment section below and I'll do my best to answer them. If you also have any experience of neck pain and what you've done to help relieve it, then also put that in the comment section below. Now, the next thing for you to do is to look for the next video, which will be here. Go and have a look at that video, the best one for you, and I will see you in that video. So stay safe, guys, and I will see you soon. Bye-bye.